When skin cancer is removed, what happens to the missing skin? Today we're going to be talking about full thickness skin grafts. My name is Dhalia Masud and I'm a plastic and reconstructive surgeon. So you've been diagnosed with a form of skin cancer. This may be a basal cell carcinoma, a squamous cell carcinoma, or many of the others that need to be removed. Usually this can be done under local anaesthetic. Now, if this is in an area such as the arms or the legs where you have lots of excess loose skin, it can usually be closed directly, and you'll be usually left with a straight line scar. Now, in some areas such as the scalp or the forehead, the skin isn't quite loose and there isn't enough excess skin. So what do we do with a hole? Now, one solution is using a full thickness skin graft. And that's when we take skin from another part of your body to cover the defect or fill the defect. Now, where we take the skin from, there needs to be some loose skin. And this is usually in front of the ear, behind the ear, the neck region or the arm. And what we do is we take a thin sliver of skin, and when we take the skin, we can usually close this area directly, leaving you with a straight line scar. So you have to be aware when you have a full thickness skin graft procedure, you will have two areas or two scars that need to be managed. Once we've taken the skin, we will need to apply this to the hole that's been created after the skin cancer has been removed. We usually stitch this in with dissolvable stitches and sometimes removable stitches, and then we will cover the area. Now, different surgeons will cover the area with different types of dressings depending on their preference. I usually vary between using chloramphenicol ointment and a simple dressing, but some surgeons may opt to stitch the dressing in to apply pressure to the skin graft to make sure it really sticks to the bed. What will happen to this skin graft? Now, this skin graft doesn't have its own blood supply. What happens is that your body or the area that it's stitched down to gives it a new blood supply. Immediately after applying the skin graft, it does appear ivory coloured or pale. And this is usually the colour it stays at in the first few days. After 24 to 48 hours, it will have a mottled appearance. It may have some swelling in it, which is completely normal, but generally it would look bluish and purple in colour. So in the first few days after your surgery, it's important to avoid its excessive movement, because this again can lift the graft off the bed. And smoking is also a no-no after this kind of surgery. Sleep upright, avoid any heavy lifting and bending over, and make sure that the area is covered. Now, when we see you in our dressings clinic, we will remove the dressings, both on the donor site and where we've taken the area from, and we'll give you some advice, including moisturising, to help soften the scar. Now, when you come to see us and I remove the dressing, it would look more pink and sometimes purple. And this is completely normal. It will also have a hard appearance to it. This is usually the critical period, and in some patients what may happen is that part of the skin graft may look very dark, and that may be because there's a clot overlying it, or part of the skin graft may have failed. If it's a small area, we continue with the dressings and allow the rest of the graft to heal and take over the healing process. So in the first week, it will go through a variety of colours before it settles down. After 2 to 3 weeks, it will start to develop into its own natural colour, but it can, for some people, take a good few weeks before it does this, particularly if you've had a small area of skin graft that hasn't taken. Now, for the skin graft to settle, it can take up to a year. So during this period, it will go through a variety of textures, going from soft to feeling quite hard, and then the colour may change purple, and then it will settle into its natural colour. During this process, while it's dry, it's important to massage this area with moisturiser to help soften the area and also improve the skin colour. What you will find with skin grafts is that although we have taken the skin from your body, there will always be a little bit of colour discrepancy between the skin graft and the surrounding area. So you will notice a distinct round scar where the graft is, and then your normal skin around it. This, unfortunately, is part and parcel of the skin graft, and it's something that you need to accept before having the skin graft. The other thing that you need to notice about the skin graft is that the normal thickness of skin in the area that we've taken the skin from is likely to be thin. So the skin graft is thin. So you may notice some indentation where the graft is. And as the graft settles down to its new area, it will fill out a bit. But there will always be a little bit of a contour irregularity in this area. Now, how do you manage these long term? Now, because you have had skin cancer already, it is likely that you are susceptible to more skin cancer. So it is general rule of thumb, you need to protect your skin anyway. But specifically to skin graft, they are more susceptible to sun damage. So you need to ensure that you wear sun cream in sun exposed areas, but also when you go out on a regular basis. There are risks with this operation. We've already discussed one of those risks, and that is partial failure of the graft. If it's a small area, we just allow it to heal on its own. Now, if it's the entire graft, in some cases, we may allow the wound to heal on its own through what we call secondary intention. Now, if it's a large area or the entire graft has failed, it depends on how big the graft is. Now, your surgeon may decide it's suitable to allow it to heal on its own, and what happens is that you may develop a thicker scar. Now, if it's a large area of skin graft in a sensitive part of the body, your surgeon may decide that he wants to redo the skin graft. Also, please be aware that you need to stop smoking prior to this surgery because it does increase the risk of graft failure. Other risks of the skin graft are infection, bleeding. Now, bleeding is incredibly important because if you do get bleeding between the graft and the bed of where we've applied the skin graft to, it can stop it from sticking. So it's important to sleep upright if it's on your head to make sure that the blood pressure is kept low, and that reduces the chance of it bleeding. There's always a risk of infection, scarring, which can become quite thickened and hard, and you will get some numbness in the area. Generally with scarring, it is important to massage the area to help soften the scar. When we take the skin cancer away, we will send it off to the laboratory to confirm A, the diagnosis, but B, to ensure that all of it is out. The results take about 4 to 6 weeks to return, and I will contact you with the results. I hope this information has been useful to you. If you do have any further questions, or if you are on the waiting list for skin graft surgery, let us know and we'll see what we can do. Take care. Bye.